Good afternoon and welcome to the Wavy Digital Desk. Today we're talking about staying healthy during the holiday season. I know we just came off Thanksgiving and everyone has had time with their family and friends. Well, that is going to continue throughout December and even into January as we hit New Year's. So we're going to be talking about those flu numbers, maybe RSV, and some of the, what we're seeing down here locally, as well as some national information. So I want to bring on our guest today, Dr. Laura Sass. She is with CHKD and she's an infectious disease doctor.
Morning or afternoon.
Yes, I know, right? It's hard to tell sometimes. Well, Dr. Sass, thank you so much. I mean, it's getting dark so much earlier now, too. You're like, what time is it?
Oh, that's true.
Well, thank you so much for joining. I think there's been a big look at sort of the numbers right now and, different news outlets are covering it. I think there's probably also a lot of questions, whether it's a pediatrician's office or primary care office. I'm sure they're seeing some stuff, but, there's this feeling of the South numbers are really starting to grow. But is that what we're seeing here in Hampton Roads and here in Virginia?
Yeah, I mean, this is our typical respiratory viral season. That normally starts in our region in October. Now, during the pandemic, some of that timing of when we saw the respiratory virus was altered because, as we know, masks do help prevent spread of these infections. And during the pandemic and masking, we did not see as much as we are seeing now. We have been seeing a lot of RSV, including into patients that need to be admitted to the hospital. We have not yet seen a lot of flu. We're continuing to see a little bit, but not nearly. I think has been reported on some of the news stations, or nationally and regionally, we are slowly starting to see those numbers go up. We continue to see SARS-CoV-2, which is the virus that causes COVID-19. Our traditional peaks over the past 3 years for our health system, we have a big peak in late summer, early fall, which is what we exactly saw when school started. We then kind of drop down a little bit, and then we'll usually peak again in December into January. And that's kind of been our theme over the past 3 years.
And you say the past 3 years because did COVID shift some of the timing of some of these illnesses?
Oh, definitely, because respiratory viruses are spread by droplets when people cough or they cough and touch their hand and then they touch something else, and you can transmit the viruses that way. So RSV, influenza, COVID-19, all of those other viruses are transmitted the same way. So when you mask for one, you're essentially masking for all of them. And what ended up happening is that actually altered a lot of how we saw the seasonality of our respiratory viruses. So in 2021, for example, we saw a lot of RSV in the summer, which was unusual. But it also timed with the lifting of a lot of the mask mandates and a lot of the reintroduction of people going out and about and congregating and with school. And so this year has been a little bit more typical than we had in the past, which was not.
And in terms of the numbers, I think, the CDC data is about a week or so behind, when they're able to report. So we don't really know yet the effects of holiday travel and seeing families and sort of getting back to maybe reunions and such. But as the South sort of grows red, is that something that you're keeping an eye on just in terms of state to state travel, people coming in town for the holidays, sort of people moving around?
Yeah, we generally tend to see a peak after Thanksgiving, just like we see a peak after school starts. And then we'll keep track of that. I continue to monitor our viral testing, especially for COVID-19, and have for the past several years, to kind of so we can keep abreast if we see any patterns that are developing. And it will go up as people congregate. Also, it gets cold outside like it is today. So you're more likely to be inside your house or inside a room with rather than doing outdoor activities like we do in the summer. And so that increases your risk for transmission of these viruses.
And in terms of, you mentioned RSV being something that you all are really looking at right now. There are different vaccines for different age groups, and there's a different amount of, shortages or availability really for some of that. I mean, how are you seeing some of that come into play, here in Hampton Roads?
So you're correct. So there are 3 vaccines that are, three immunizations that are available. So one is for pregnant women, which of course, as a pediatrician, I don't see. And then another one, which is readily available, is for those adults greater than age 60, which again is not something that I've been giving because they are outside my age range. The immunoglobulin that became available and was announced in September is available some places, but unfortunately it was not as available as I would have liked it to be. And so we did not get a very large supply. That is actually an immunization in which you get a passive antibody. So you're giving someone that immune part to the RSV, and it's designed for infants to prevent them from getting a significant RSV infection. Because remember, vaccination does not prevent infection. Vaccination prevents the serious complications of those infections. And so that's why we have an influenza shot, a COVID shot, and now we have this RSV antibody. But when you announce something that can be given to all children under age 8 months, you don't always have enough of it to go around. And so here at CHKD in the main hospital, we have prioritized our doses that we did receive for our most vulnerable patients, such as those leaving our neonatal intensive care unit. The rest of the infant population will need to obtain it at their general pediatrician's office, which is where it was really intended to be given in the first place.
And in terms of, availability and sort of figuring out what populations to really give it to, I mean, is that something you're hoping to get different sort of amounts later this season? Or is this really when RSV is at its largest, so you don't really expect to be giving these vaccines?
That is an excellent question. We're hoping we'll get more supply in after the first of the year, but it all depends on the supply because they have to make it. And we would continue to give it. Traditionally, we consider RSV season from October to March. So even if we had supply in January, we would still be able to give it to those eligible babies.
And, in terms of RSV, that is something that does affect a lot of people, but you obviously look at that younger age range. For that, I mean, there are a lot of symptoms that seem to, at least to me, to somebody who, isn't as familiar, seem to overlap with a lot of other illnesses this winter. I mean, is it common for people to sort of also present maybe with a cold or present maybe with symptoms that are common to either COVID or the flu? I mean, how do you sort of differentiate between all of it?
Yeah, you are exactly right. Upper respiratory infections all present very similarly. There are some things that are a little bit different. Like, for example, influenza can just be a simple cold and a runny nose, but it can also give significant high fevers in some people, along with the body aches and just overall not feeling well. COVID-19 is the same way. RSV tends to do milder disease in older children and teenagers. But it much affects the infants and the elderly much worse. And so that's why those populations were targeted for those immunizations. And so for babies, what we worry about with RSV is that it can cause them to have fast breathing, noisy breathing, difficulty breathing, and cause them to wheeze. And that is why it makes it so more dangerous in those children less than 2 to 3 months old compared to a 3 or 4-year-old who may just have a runny nose.
And I don't know what you're seeing outpatient versus, some people that are more maybe need inpatient treatment. But, I guess what kind of load is this really putting on the hospital right now? Is it not? Are we sort of in a safe place right now?
We are busy. I would say probably about half our inpatients probably have RSV or some version thereof. And it does, but that is what we expect at this time of the year. Not any more than usual. We are prepared at CHKD to kind of handle those surges. And so the majority of those patients, of course, don't need to be admitted to the hospital. And many of them can be taken care of at home and, after seeing your pediatrician. But we are seeing a lot of respiratory illnesses and pneumonia, but that is also what we expect at this time of the year. So yeah, we're hanging it. We're doing it.
You're in the thick of it right now. I know.
It has been probably since mid-October. So things probably will slow down a little bit, and then we'll pick back up after the holidays because everyone comes together and everyone wants to kiss those babies, and maybe you shouldn't.
And we'll talk about that too. I want to ask you about, some of the best practices, but just to jump back to flu real quick, same thing with RSV that I asked. People might not have gotten their flu shot yet, or they might think it's too late. Is that the case? Should they still be getting it right now?
Please get it. And especially right now that we know we haven't really hit the peak of flu. Generally for all immunizations and shots, it takes about 2 weeks for your body to get a full effect. So now is the time. Get it now before you head off for your Christmas parties, and so you'll have the best protection. Even if you wait until January, you're still going to get some protection, because the later that the flu season starts, the longer it goes. So, getting your COVID-19 shots, your influenza shots, and if you're over the age of 60, your RSV shot will help protect you for the holiday season.
And, then jumping into other best practices for holiday season. So we've talked about, either immunizations or vaccinations. Are there other best practices? I think some of them might be common knowledge to some people, but I think a reminder is always helpful.
Yes. Don't go places if you're sick. Some of this is really common sense. It's really hard to have to turn down a holiday party or another event you're looking forward to. But if you have a fever, you're having a heavy cough or runny nose, it's probably best not to attend. Or if you are going to attend, wear a mask. Masks work. They help prevent those respiratory droplets from spreading. And especially if you're in a closed, small room with not good ventilation, that increases your risk to get those infections. And it's not just COVID-19, it's the flu, it's RSV, it's all of those viruses that are passed that way. Good hand washing is important. As you see, as you're playing the video and watching people blow their noses, washing your hands after you do that, either soap and water or with one of the alcohol-based hand products, that helps prevent things too. Doing that before you eat. And that lovely child coughing into his elbow, that's beautiful. Because you don't want to cough into your hand, because then you have all those virus droplets on your hand and then you touch something. Like the grocery.
Right, absolutely right. And I think they've done tests on sort of the bacteria that comes off of them, even after a wipe and different things like that.
Yeah, the entire world is covered with different germs. So hand washing is a good thing.
Absolutely. And then the other thing I want to ask you, and you all talk a lot about, I think, doctors and donors, communal places, whether that's a gathering, a flight, an airport, you're going out to a restaurant during the holidays when it's busy, or an event. I mean, what are some things, I guess, when you are in those close proximities with people, especially after that holidays? I know that we have a week-long sort of, for some people, break between Christmas and New Year's this year. For all of these moments where you're sort of in these social situations, I mean, is it stay home if you're sick, but then when you're in them, should you be careful about shaking everyone's hand, making sure you're washing your hands, making sure you're aware of if there's maybe elderly or more vulnerable populations with you?
That is perfect. Yeah. And you also want to look at the situation. Outside is always safer because there's a lot more air circulation, and you have the opportunity to physically distance. We know that when you cough someone coughs and say they don't cover their mouth, those droplets can spread anywhere from 3 to 6 feet apart, from where you are. And so when you're outside, you have a much, like, say, if you're going ice skating, those probably situations where there's enough movement and circulation, but you're at probably a lower risk than, say, that you're in a crowded movie theater and sitting next to someone who's coughing. I still am a very strong proponent of wearing a mask in some of those situations where I can't control the other people around me. I can control my risk and my exposure by protecting myself that way. And also always carrying around that alcohol-based hand hygiene product so you can wash your hands in those situations. And, being cognizant of who you're going to be with. If you have a less than 2-month-old and you have a cold, trying to keep your distance from that child, or from an elderly grandparent, or someone who's had an organ transplant or has cancer. You don't want to, no one does it on purpose, but if you can help mitigate their risk, because they're more likely to have a worse infection and a worse outcome than someone who is otherwise a healthy kid or a healthy adult. And so just kind of, use the lessons we learned during the pandemic and kind of be more cognizant of what you're doing. Don't go to work sick. I mean, and that's a hard thing, even for our hospital, because that's not something that was traditionally, thought of, that it was okay, I just have the sniffles, and kind of think about your surroundings a little bit. And that'll give, just having that awareness actually helps protect people, because it makes you remind you to think about what you're doing.
Yeah, I mean, when you talk about masks, the first thing I think of, if there's someone next to you on a plane and they're coughing, or they're sneezing and they're spreading those germs, and but just those situations, yes,
Oh,
wear
the
a mask,
airport. Yeah,
right?
the airport is not a
Not a safe place. Yeah.
I mean, I when I travel and I'm in the airport, I usually have a mask on. Now, when you're in an airplane, they actually have pretty good air circulation in those planes, so that's probably a little less risky than being in the actual airport, but not if someone's sitting next to you coughing.
And I do want to ask, you mentioned people going to the hospital and maybe not feeling great, whether they're a patient or somebody that works there. I mean, is the best protocol really to call your pediatrician or maybe even get tested before you're sort of going into some places if you're nervous that you might have something?
Yeah, and there is, most pediatricians' office will have rapid tests in their offices. We at CHKD have a whole array of different testing for various viruses, especially focusing more on RSV, influenza, and COVID, because those are actually viruses that we either can treat with different medicines or have a different risk factor for those little babies. And so it's never wrong to test. It's interesting how the pandemic has changed that, because there are still home tests for that, for COVID-19. But interesting, we don't yet have home tests for the flu and RSV. And so that kind of really changed the way that people view respiratory infections a little bit when it comes to testing. And so if someone's really ill and they're not feeling good, it's never wrong to call the pediatrician and ask them a few questions, because for the most part, a normal healthy kid just needs supportive symptomatic care, keeping them hydrated, making sure they're eating a little bit, treating some of the symptoms, like if they have a fever. A lot of those over-the-counter cough medicines really don't work. And it's not necessarily, and I think the FDA has put more information about that out over the past couple of months, and how really the cold medicines aren't as helpful as we would like them to be. And we definitely don't like giving them to small children, because a lot of those are more than one medicine in one liquid, and can cause harm that way when you don't unintentionally mix and match those medications.
And that reminds me sort of, we're talking about things you might do at home, but is there a point where there's maybe some red flags or people do actually need to seek that more emergency care?
Always, if your child is not acting right, you as a parent know how your child's normal behavior is. And if they are very sleepy, they're not wanting to eat, those are signs. Fevers greater than 103, 102, especially if they had a fever, it went away for a few days and then came back. Those are situations where to call. Anyone with trouble breathing, if you can't catch your breath, or you're having such horrible cough that you can't catch your breath, or when you look at a baby and you can see where they're breathing and they're sucking in those muscles in between their ribs, those are all times where you need to be seeking medical attention.
And, just to go back to the flu data real quick, right now we're seeing more red outside of Virginia. Virginia had a slight increase and is now moderate, according to that recent report. Mm-hmm. But it's not really a sign for people to sort of breathe a sign of relief and not really worry about it in Virginia, right? You sort of want people to have those best practices.
Yes, because it means it's coming. We watch flu spread across the world. It starts off in Australia in our summer, because that's their winter, and then we watch it migrate across the planet. And so it just kind of, it will come. And the way that the influenza works, it comes in seasons, and some seasons are really bad and some seasons aren't, and it's always a little bit different every year. Some seasons start earlier than others. Right now, we're kind of, not seeing more than we would anticipate. We're also not seeing tons of it as well. We're seeing a lot more RSV. And so it'll come. And so it's always best to be prepared.
And I don't know if this is significant, with a percentage like this, but right now they're saying in Virginia, with the Virginia Department of Health, the largest population for flu right now is that 0 to 4 age group, about 14.8%. They're just calculating visits, so I don't think it has to calculate, severity or anything. But no, I mean, is that big to you?
It's getting there. Usually we consider a season to start when you hit over 10 to 15%. So yeah, it's getting there. I know that for our testing numbers, which I review, we're seeing a little bit of flu A and a little bit of flu B. It's kind of variable, which is a little unusual because we tend to see flu A first and flu B later in the season. But they call it the same illness. So, it's just more of an interest to see. So that's, yeah, and that's not surprising because if you think about it, those are our youngest, most vulnerable patients that generally haven't had a flu season yet. So they've never been exposed to those viruses yet. And so then that's when you end up with usually worse symptoms because you have no natural immunity.
Right. And then,
you can't get your flu shot till you're 6 months old.
Right. So you're in that sort of protected group.
A little bit, yeah. Especially too, when we have kids, their first entry into daycare or to school, they're going to be more likely to get infected with a new virus that they haven't seen before because they hadn't been in that situation. People who move, you move from one area, even one area of the state to another, you're kind of exposed to the different germs that are in that new area that can make you more likely to get sick.
Right. And then especially as you're traveling around, I don't know if, especially if you're college kids coming back for like a 3 or 4 week break, you're bringing back things, but you're also being exposed to it, right?
Yes. Yes. My daughter goes to Virginia Tech and the Hokie plague is real, and so, you have, just like at the beginning of going to the first day of school for preschool or for kindergarten, college is the same thing. You put a mix and match a whole group of new people together, they're going to share their germs. And so when you have people coming from college and coming back home, yes, you're going to potentially have more exposures. Same thing with people coming to visit, your extended family coming into the area for Thanksgiving or for Christmas and for those holidays. That's the opportunity to spread some new germs in your house.
Well, it's something that we all really want to stay protected from, I know. So, thank you for all of the tips and advice today. I don't know if there's anything else. I know we mostly focused on flu and RSV. We talked a little bit about COVID, but is there anything else just in general you would like people to pay attention to this holiday season?
Just use common sense. If you're sick, stay home. Wash your hands. Don't be afraid to wear a mask. And please get your immunizations. Immunizations, remember, aren't necessarily going to prevent you from getting that infection, but it will prevent you from getting those serious complications for an infection and hopefully prevent a hospitalization in our most vulnerable patients. So that's usually my message.
Absolutely. Well, Dr. Sass, thank you so much for joining us this afternoon. We really appreciate your advice.
You're welcome. Have a wonderful afternoon.
Thank you. You too.